Hello, my name is Shelbie Stahr and I will begin the annual Foodborne Illness Seminar. Foodborne illnesses have several names, such as foodborne infection or food poisoning. According to the CDC, this illness is common, costly, and yet very preventable in public health today. There are three types of foodborne illnesses: bacterial, viral, and parasitic. Some examples of bacterial are anthrax, salmonella, and cholera. Examples of viral are hepatitis A, C, norovirus, and rotavirus. And examples of parasitic are a Giardia infection and toxoplasmosis. There is no one specific definition that encompasses a foodborne illness. However, generally, the microbe or toxin enters the body through the gastrointestinal tract and often causes the first symptoms there, but we'll get to those later. There are various stages where food can be contaminated. In the production stage, healthy animals can become infected by microbiomes in the slaughtering process when they come into contact with intestinal matter. Similarly, fruits and vegetables can be washed with contaminated water. Seafood, such as shellfish, can become infected when they collect bacteria in the water they live in. Later in food processing, other foodborne microbes can be introduced from infected humans who handle the food, such as unwashed hands, or by cross-contamination from some other infected products in the facility. In food preparation, the microbes can infect the food by unsanitary cooking utensils that have touched the contaminated products. Unclean surfaces and improper washing between products are also a cause. Food that is fully cooked can become recontaminated if it touches other raw foods or dripping from raw foods that contain pathogens. The way that food is handled after it is contaminated can also make a difference in whether or not an outbreak occurs. Microbes multiply at a fast rate. When dividing, they can produce up to approximately 17 million new microbes every 12 hours. So if food is left out overnight, they may contain a high bacterial load, which refrigeration could have prevented. Salts and high temperatures above 160 degrees Fahrenheit are other ways to kill and prevent bacteria from growing. Some symptoms of foodborne illness are dependent on the type of microorganism present. However, many foodborne illnesses share common symptoms, including vomiting, diarrhea or bloody diarrhea, abdominal pain, fever, and chills. Some more severe pathogens and cases can cause toxins to result in some chemicals that affect the nervous system, causing symptoms such as headache, tingling or numbness of the skin, blurred vision, weakness, dizziness, or paralysis. This chart shows the top 5 most prevalent pathogens contributing to domestically acquired foodborne illnesses in the United States. As you can see, these 5 pathogens make up 91%, a high amount, but leaves 9% to many other pathogens that have been identified. All foods, regardless of how or where they were produced, carry a risk for causing foodborne illness. Raw foods of animal origin are the most likely to be defined as high-risk foods, such as raw meats and poultry, raw eggs, unpasteurized milk, and raw shellfish. Leafy green vegetables, like tomatoes and cantaloupes, can also carry microbes that can cause illness. People do not normally think of shellfish as being contaminated food, but rather just improperly cooked. But Ralston from the Journal of Water and Health states that the health consequences due to marine-borne pathogens in the U.S. have an annual cost of around $900 million and therefore should not be overlooked. The Center for Foodborne Illness Research and Prevention states that food that mingle the products of many individual animals, such as bulk raw milk, pooled raw eggs, or ground beef, are particularly hazardous because a pathogen present in any one of these animals may contaminate the whole batch. This means that one package of meat or one carton of milk can be from hundreds of different animals, which gives you an increased risk for contamination. Fruits and vegetables consumed raw are a particular concern. Washing can decrease but not eliminate contamination, so the consumers can do little to protect themselves. The recent outbreaks in vegetables are mostly due to unsanitary water used to prepare and clean the produce for customer consumption. Similarly with meats, water that cleans all the vegetables can result in pallets of unclean vegetables being distributed to businesses across the country. Everyone eats, so everyone is at risk for foodborne illness. For people in the vulnerable populations, children under the age of 15, pregnant women, seniors over the age of 65, and individuals with compromised immune systems, foodborne illnesses can become a life-threatening illness if the foodborne pathogen enters the bloodstream of these populations. Of these vulnerable groups, children under 15 and seniors over 65 are the ones at greatest risk for serious illness, such as bloody diarrhea, which is a serious medical emergency and should be treated immediately. The Centers for Disease Control and Prevention have reported that there are 31 known foodborne pathogens. The remaining 200 plus pathogens are called unspecified agents. Most of the known foodborne pathogens have both acute and long-term health effects. Many people think that foodborne illness is rare, but it is not. According to the CDC, each year 1 in 6 Americans are sickened by a foodborne illness, with 128,000 hospitalizations and 3,000 deaths. For the vulnerable populations, children, seniors, pregnant women, and individuals with compromised immune systems, the impact of the foodborne illness can be life-threatening or life-altering. Even though these populations I have just stated are indeed vulnerable, a study conducted in Canada states that young adults ages 19 to 29 are undereducated in food safety. Common illnesses were overlooked and not often recognized. This indicates that everyone is indeed at risk for a foodborne illness, but you can help prevent them with education of food safety. Research is in process to better understand which foods carry the highest risks and who is most likely to be impacted. Below is a list of recently identified pathogen food combinations. These top 10 pathogen food combinations, as measured by the annual cost of illness and by the quality adjusted year life loss by combined rank. The USDA identifies 3 economic incentives most likely to result in the production of safe food: market forces, food safety laws and regulations, and product liability. Market forces. In the real world, consumers do not have all the information we need or want on our food companies. We preferably want these companies who violate safety laws to lose revenue and be punished for this. But that is not always the case. In a standard economic model, the market is most beneficial when both consumers and producers have complete information. Food safety laws and regulations. We would prefer government-regulated fines when products are recalled or produce an illness, but the Food Safety Inspection Service does not always have the power to make some of these recalls. It can sometimes require the CDC to report strong evidence of a correlation before regulations can be made. Product liability. Unfortunately, there is a very low incentive to produce safer food. Only approximately 34% of outbreaks can be linked to an identifiable source of the cause. Therefore, companies have a 70 to 80% chance of not being held financially responsible for the damages relating to their products. The U.S. Department of Agriculture has identified specific challenges with accurately estimating the economic burden of foodborne illness, and one of these factors is attributing foodborne disease to particular foods. Studies have indicated that safe food handling practices are correlated to decreasing rates of foodborne illnesses. Many stakeholders do not understand the science-based food practices in food prevention, which makes it difficult to adopt these practices into reality. According to Drew of the Food Science Policy Alliance Research Center, the key to effective management of these businesses is good communication, collaboration, and a realistic and enforceable procedure list. To be able to provide these incentives to the stakeholders, they must be realistic. I have mentioned some of these statistics before, but I want to bring them all into perspective. Each year, 1 in 6 Americans gets sick by consuming contaminated foods. Many different disease-causing microbes or pathogens can contaminate foods, so there are many different foodborne infections. The federal government estimated that there are about 48 million cases of foodborne illness annually. And each year, these illnesses result in an estimated 128,000 hospitalizations and 3,000 deaths. More than 250 different foodborne diseases have been described. Most of these diseases are infections caused by a variety of bacteria, viruses, and parasites that are foodborne. The 2011 estimates provide the most accurate picture of which foodborne bacteria, viruses, microbes are causing the most illness in the United States. According to the 2011 estimates, the most common foodborne illnesses are caused by norovirus and by the bacteria Salmonella, Clostridium perfringens, and Campylobacter. To talk about some specific bacteria, we will discuss Listeria and E. coli. Listeriosis is caused by eating foods contaminated with the bacterium Listeria. The disease primarily affects older adults, pregnant women, newborns, and adults with weakened immune systems. However, rarely people without these risk factors can also be affected, and if infected, have very mild symptoms. Common symptoms include fevers and muscle aches. Almost all cases spread beyond the GI tract, and high-risk populations will have prolonged symptoms. Specifically, pregnant women will have other symptoms such as fatigue and aches. This can also lead to health issues directed at the baby, such as miscarriage, stillbirth, or premature delivery. In the elderly population, this can also lead to meningitis. E. coli bacteria typically live in the intestines of people and animals. In the normal host, E. coli do not pose health problems and remain in the stomach. But when they do cause illness, either diarrhea or illness outside of the intestinal tract, transmission can be through contaminated water or food or through contact with animals or other people. E. coli is very diverse and has 6 pathotypes associated with the tract. The most common pathotype is Shiga toxin-producing E. coli, which is heard about in the news in association with foodborne outbreaks. Different groups of people have different prevention methods. The government, for example, implements policies and regulations, increases and improves inspections in the United States and abroad, develops and implements safety standards for food, regulates food production facilities and guidelines, tracks trends, reports progress, and makes sure policies are aimed at reducing infections, and funds state and community efforts to identify and report sicknesses and catch outbreaks before they spread. Farmers and other food distributors can adopt proven preventative measures for food safety plans in all food production and service facilities. They can keep records of where food and ingredients are imported and exported. They can train and certify managers in food safety in all restaurants, adopt proven preventative measures for safety plans in all food production service facilities, train and staff adequate managerial positions to monitor contamination when raising livestock or other food animals. Healthcare providers can diagnose, treat, and report infections, talk to high-risk patients about food safety and preparation, and report suspected outbreaks to their local health department. Everyone else can use safe food and water, clean, wash hands, utensils, and countertops, separate raw meats and produce, use proper cooking temperatures, store foods in cool temperatures, report suspected illnesses for food to your local health department. Don't prepare food for others if you have any foodborne illness symptoms, and be careful for preparing food for high-risk populations. Many people are unaware that chronic health effects have been linked to several foodborne illnesses. For example, having salmonella is a known precursor for developing a painful and debilitating joint inflammation, which is commonly known as arthritis. Campylobacter, a bacteria that causes intestinal infections and is the leading cause of Guillain-Barré syndrome, an autoimmune disease that causes paralysis and kills 5 to 10% of its victims. Kidney failure has been linked to listeria, which kills 1/3 of its patients. And hematomic uremic syndrome can cause an array of chronic health effects, such as blood pressure and diabetes. An article produced by Esselstyn gives a very interesting proposal that cardiovascular disease is a foodborne illness. She describes that CVD is a disease of nutritional extravagance and that we are essentially on both ends, not keeping the body in a natural state of homeostasis. We are depriving our bodies of essential things such as blood, which can cause other conditions. To end this seminar, I will now discuss the foundations and principles of HACCP, which will be implemented in the company today. This is a management system in which food safety is addressed through the analysis and control of biological, chemical, and physical hazards from raw material production, procurement, and handling to manufacturing, distribution, and consumption of the finished product. The foundation of HACCP can be found in the 7 principles that describe its function. These 7 principles are: number 1, conduct a hazard analysis, having a set plan when hazards occur, and having a planned out method to prevent them. Principle number 2, identifying the CCPs or critical control points in the process. Principle number 3, establish critical limits for preventative measures associated with the identified CCP and ways to assure these measures are being met. Principle number 4, establish CCP monitoring requirements and having set procedures on what the threshold limits are. Principle number 5, establish corrective action to be taken when monitoring indicates that there is a deviation from the established critical limit. Principle number 6, establish effective record-keeping procedures that document the HACCP system. And principle number 7, establish procedures to verify that the HACCP system is working correctly. This system has been put in place to minimize any possible risk of foodborne contamination. And that concludes my seminar on foodborne illness. Thank you so much for listening, and my references are on the next 2 slides.